Prenatal and perinatal problems and solutions. Although most babies are born healthy, many babies exposed to teratogens, which are harmful substances, can develop abnormalities. Teratogens can have physical effects, such as neural tube defects, and/or behavioral effects, such as hyperactivity, though the latter are less straightforward. Although teratogens should be avoided throughout pregnancy, their negative impact depends on several things. First, the effects of teratogens depend on critical periods. Remember that these are time spans when certain things must happen. In prenatal development, for example, the growth of arms and legs occurs between 28 and 54 days after conception. If a substance that blocks growth is ingested during this period, the newborn baby's arms or legs will be deformed or missing, as was the case with babies whose mothers took the anti-nausea drug thalidomide in the late 50s. Second, some substances are only harmful at certain levels of exposure. Third, some people are genetically more vulnerable to the effects of certain teratogens. Many harmful teratogens can be avoided altogether. For example, viruses and infections can be prevented or treated with immunizations and antibiotics, and with good prenatal medical care. Substance use, including excessive use of caffeine and even moderate use of alcohol, should be avoided prior to becoming pregnant and during pregnancy. Stress management, good nutrition, and moderate, not excessive exercise can all contribute to better health outcomes for the baby and for the mother. Low birth weight is defined as a birth weight of less than 2,500 grams, the equivalent of 5.5 pounds. In the United States, approximately 8.1% of all live births involve babies with low birth weight, a rate much higher than that of other developed nations. There are several risk factors associated with low birth weight, including preterm delivery, meaning that the baby was born 3 or more weeks before the full 38 weeks of pregnancy, that is, before 35 weeks after conception, maternal or fetal illness, or more commonly, maternal drug use or malnutrition. Drug use and, in many cases, nutritional deficiencies are preventable problems. It is crucial for a woman to have good social support during pregnancy to help reduce the risk of behaviors that contribute to low birth weight. Extremely low birth weight is a major cause of infant mortality. Among the smallest babies who survive, milestones such as smiling, walking, and talking are often delayed. Cognitive problems such as attentional deficits and language delays, as well as behavioral problems, are common, though not inevitable. An essential strategy for addressing problems is accurate assessment. Most babies are assessed with the APGAR scale at 1 minute and 5 minutes after birth. 5 vital signs: the baby's color, heartbeat, reflex irritability, such as coughing, sneezing, or crying, muscle tone, and respiratory effort, are scored on a scale from 0 to 2, with 10 being the highest possible score. Babies with lower than expected scores, less than 7 at 5 minutes, receive emergency care. A lengthier assessment is the Brazelton Neonatal Behavioral Assessment Scale, or NBAS, which measures 46 behaviors, including 20 reflexes. Reflexes include protective behaviors such as crying, sneezing, sucking, and shivering when cold, as well as other behaviors that signal adequate brain functioning, such as the stepping reflex and the palmar grasp. Although the NBAS is not universally used, it can be helpful for identifying strengths and weaknesses in very early life, which is necessary for treatment planning when there is a problem. Reflection. How does knowing about prenatal and perinatal development help you understand a child's current level of academic and social-emotional functioning? Do you think that schools should play a role in providing prenatal care and education to pregnant adolescents? Why or why not?